towards resilience and well-being, rethinking health systems in a planetary health era. We're very happy to have you join, and we are still waiting 2 minutes more to give people the chance to enter. Hello, everyone. We are starting soon with the webinar. We are waiting for another minute or so. Please note that this meeting will be recorded, so I kindly ask you to accept the notification that you receive when you enter. Okay, so welcome everyone. We are starting the webinar on the topic of resilience and well-being, a really important topic these days, not only when we watch the news, but also when we think about the different crises that are hitting our societies and our planet. And today we want to have you on board for a discussion on how we can rethink our health systems in this time of crisis, but also in the time of planetary health, of climate change, but also other crises that we will be touching upon. And how can we strengthen resilience and well-being in our societies? This is part of the webinar series of the European Public Health Conference that is taking place in Helsinki in November. And I'm very happy that you're joining us today. My name is Andrea Schmidt from the Austrian National Public Health Institute, and I'm very happy to lead you through the next 1 hour and 15 minutes. There are a number of speakers that you will be listening to, and at the end we will also have time for a Q&A session, so that you are very welcome to post your questions in the chat, and we will also give you a couple of inputs in the presentations, but also in a short roundtable discussion at the end. So without further ado, I would like to start with a couple of housekeeping information about how to go through the next 1 hour and 15 minutes. Please keep your camera and microphone off unless you are speaking. We very much encourage you also to actively participate by writing your questions to the chat during the presentations. And then afterwards, as I said, at the end, we will have time for a Q&A session where we will get back to these questions. The webinar will be recorded, so please accept this notification when you enter, and also share with your colleagues the recording that will be available later on the EPH conference website. At the beginning, we would like to share with you a short video about this conference, and I invite you to listen and watch for the next minute. So yes, we already got a couple of food for thought in this video about the conference, and such as investing in health, a sustainable future. These are all topics that public health researchers, but also practitioners and policymakers deal with these days. And as I said at the start, today we want to talk about how we can transform our health systems to become more resilient and foster well-being in times where resilience is more and more important. As our keynote speaker, I would now like to introduce to you Julia Zimmermann from the European Observatory on Health Systems and Policies, where she is a research fellow. We're very honored to have you here. Julia is based at the London School of Economics and Political Science with the Observatory. And before she joined the Observatory, she worked on health workforce finance at the Department of Health and Social Care in the UK. And she was also a Blue Book trainee at the European Commission in the unit measuring health system performance at DG Santé, where she worked on COVID-19 recovery funds and the state of health in the EU cycle. She's a GMC-registered medical doctor. She has worked at the clinical frontline in various medical and surgical departments and has completed her academic foundation program in Cambridge. She also holds a joint MSc in health policy, planning and financing from LSE and LSHDM. So you can see an impressive vita, and we're very happy to have you here, Julia. And I would like to give you the floor. Please, the floor is yours.
And my apologies for having some trouble finding the unmute button, but thank you so much for the introduction, Andrea, and thank you for having me here today as a keynote speaker. My name's Julia Zimmermann, and as introduced, I work for the European Observatory on Health Systems and Policies in the London Hub. And today I will be speaking to you about how you can strengthen your health system's resilience through resilience testing. But first, let's start with some definitions. So, as you may be aware, health system resilience does not have a consensus definition. And the definition we're using for resilience testing is the one you can currently see on the screen. It is quite a mouthful, so let me break it down into some distinct concepts for you. And a lot of other definitions of health system resilience also share some very similar traits to this one. So the first concept is the idea that resilience is always in relation to a shock or a crisis or something that happens in an acute sense to the health system. The second idea is the concept of time. So we're not only looking at resilience at one point in time, but we're looking at it throughout the life cycle of the crisis. So we're looking at resilience before the crisis or the shock, resilience throughout the shock, and resilience after the shock. And the last is the idea of adaptation and transformation of the system throughout the response. And the second definition I'd like to share is that of a shock, by which we mean a sudden and extreme change which impacts on a health system. So this is different to the chronic stresses that the health system is exposed to on a day-to-day basis. Now, what can we do to strengthen health system resilience across shocks? In 2020, the Observatory put together a policy brief where we brought together 13 resilience-enhancing strategies, which you can see on the slide here. These include things such as timely detection of the shock so that the health system is able to understand that a shock is happening and that a response needs to be mounted. It includes things like having enough resources, both material and from a health workforce perspective, and have flexible approaches to deliver care and adapt to the unfolding scenario. And we can also approach understanding what we can do to improve the resilience of our health system by looking at what happened during past crises. So what you can see here is a review of the financial crisis in 2008 and what countries that weathered the storm well did to ensure a resilient response. And it is things such as counter-cyclical fiscal policies, adequate levels of public spending on health, universal health coverage, and maintaining low levels of out-of-pocket spending. And much more, with more information in the publication if you should be interested. And the other big crisis, of course, has been COVID-19, the pandemic. And here we also put together strategies that countries implemented to weather the storm well. These included things such as delivering a clear and timely response strategy, stable and effective leadership, sufficient and sustainable funding to meet the needs, and implementing an effective vaccination program. And more details in the publication you can see on the screen. But research on resilience doesn't stop there and is fast evolving. And if you watch this space, the Observatory is currently putting together a policy brief with the newest insights. The brief will look at some of the capacities health systems need to be resilient, what resilience might mean in the context of equity, in the context of mounting a suboptimal response to a shock, and what that might mean in terms of legacy effects as the health system moves forward in time. So watch this space for this upcoming publication. Now, there are some broad overarching strategies on how to improve resilience. There's some learning from past crises and shocks, and there is the newest research and insights into resilience. But how does that translate to what you do in your health system context? And this is where our practical handbook for resilience testing comes in. This was designed as a tool for policymaking, and the aim is to assess the vulnerabilities of the health system to a shock and find some of those levers for remedial action that you can find and move to improve health system resilience going forwards. And at this point, many thanks to our colleagues at the OECD and at the European Union for supporting us in this project of putting this methodology together. So what is a resilience test? If I had to summarize it in one sentence, it's a carefully prepared, structured workshop that brings technical experts of the health system together for a day of discussions and assessment of resilience. You can think of it as in 3 phases. The first phase is pre-resilience test workshop, where you choose which shock you will be working on. You look at existing evidence and you prepare for the Resilience Test Day discussions. The Resilience Test Day is the day of structured discussions where stakeholders come together to assess the resilience of the health system. And by that, we are looking for the strength in the health systems, the weaknesses where the health system might break in face of a shock, and the opportunities for remedial action. And following up on the Resilience Test Day, all the evidence and data from the preparation and the day are collected and worked up to be made useful for policy making in whatever shape or form that might be suitable for the context you are in. So what are we aiming to achieve? Most importantly, we want to be detecting critical health system weaknesses, and also those opportunities for remedial action to start fixing them for improved resilience going forward. Resilience testing is a systematic approach which generates insight and evidence, and it also fosters stakeholder participation. And this is a methodology that we have designed so that it can be implemented not only in many different country contexts at a national or regional level, but also for many different shock scenarios. So on this slide, you can see the kinds of shock scenarios that might be used for resilience testing, and some examples of either some of the handbook worked examples we've provided on some of these different shocks, or some actual resilience tests we have done in the past and all the different topics we have done this on. So this is not only useful for testing, say, a pandemic, but also things like a financial crisis, climate-related incidences, or geopolitical shocks. And conceptually, these are a couple of things that we use to frame the health system's resilience test. So the first question I always get asked is, how do you define the health system? And the answer is we use a very broad definition to make sure it is suitable from all country contexts. And we also use two existing conceptual frameworks in combination to ensure a systematic approach. So the first is the shock cycle, which conceptualizes the shock over time. So it prompts you to think about what happens before the shock starts, at the onset of the shock, during the main shock response phase, and as the shock ends and as the health system recovers from the shock. And the second is the HSPA framework, which is a health systems framework that ensures that we are thinking about each and every part of the health system systematically and how the different functions of the health system might interact and affect each other throughout the shock. So we use these two frameworks in conjunction to structure the group discussions on the day, as well as to structure the preparations for the resilience test. And the important distinction here that even though this is a scenario-based exercise, it is not the same as other scenario testing exercises that are running emergency plans, simulating the response, or testing the emergency response for any gaps in them. This is a resilience test. So what we're asking the participants on the day to do is to consider the health system in the context of the shock and understand the resilience of it. So what about some of the opportunities for remedial action? Well, what we tend to find is that these usually tend to fall into two categories. The first one is that participants tend to find and highlight some of those long-standing structural challenges in the health system that we know exist. The other is opportunities that are dependent on the details of the health system, the context of the country, and the shock. And these can either be opportunities for remedial action that are valid across the board for several different shock scenarios, or they can also be some opportunities that are quite specific to the shock that you are interested in. And this is an example of how some of this might look like an action. This is an example from a resilience test we have implemented with the help of our colleagues at THL in Finland. And they were running an exercise where they were looking at a hypothetical pandemic scenario that involved children. And as you can see, the discussions and also the outcomes follow the structural frame of the two frameworks, which ensures that it covers a broad set of bases within the health system. So if you were to pick this up and do this in your own context, what advice would I have to give? Well, first of all, do pick up our handbook for resilience testing. It breaks down how to put a resilience test together in 5 distinct steps with concrete instructions on what to do, examples that are worked, and some hands-on tips from implementing it ourselves. And if I were to point to 3 things that are important to get right for successful resilience testing, it would be to ensure that you have government support and buy-in. And this is very important as it makes sure that the resilience test is fully anchored in the policy-making process. The second is to ensure independent facilitation and contextual expertise of those moderating the resilience test day and preparing for it, which ensures a legitimate moderation and preparation of the day. And lastly, the importance of the diversity of participants. So this is a bit of a delicate balance because on the one side, we're aiming for broad representation of different technical points of view from different parts of the system. But on the other day, this is a workshop where we want participants to actively join and share their experience and expertise. And what we found is a good balance between the two is to aim for about 20 to 25 participants in the room on the day. And that brings me to the end of my presentation today. If you're interested in learning more things about resilience, please pick up a copy of the handbook. You see the QR code here. And also please join us at our conference talk at the European Public Health Conference. I look forward to seeing you there. Thank you so much. And thank you, Andrea. Back to you now.
Thank you so much, Julia. This was a really exciting talk. You managed to bridge in a short period some theory about resilience. So we learned what is resilience, this word that is sometimes a little bit difficult also to understand or to conceptualize, or might seem a little bit abstract sometimes. And then you showed us that it has different phases. So we have different phases of resilience, from preparedness to response to recovery. And we also learned that actually there are different case studies that this can be applied to. So it was at the same time not just theory, but also some practical insights. And speaking of practical insights, I'm very happy that we're now moving into 3 case studies from across Europe. And the first one will be in Finland, the second one will be in Portugal, and the third one will be based in Austria. And as you remember, there were the different cycles of resilience and how we can make our health systems more resilient. And the first stage is preparedness. And Finland has been at the forefront when it comes to preparing their health system. And we will be hearing more about this from Jaana Halonen. She's a senior researcher in environmental health at THL, at the National Finnish Institute for Health and Welfare. In the past 5 years, she has been involved in research and development work related to various issues on climate change and health. And currently, she is member of the Finnish climate change panel that brings science closer to policymaking. The floor is yours, Jaana. Please present your case study.
Thank you, Andrea, and thank you for the invitation. So I'm going to give a Finnish example about how the preparedness of the health systems has been pushed forward, and this focuses on climate change. So what we have started with is adaptation plans. Already in 2021, we published the first climate change in the social and health sector adaptation plan. And this work was led by our researchers from the Finnish Institute for Health and Welfare, but then several other organizations were also involved in this work. This adaptation plan already included 92 points of action that we could aim at improving the adaptation in the health and social sector in general. And some of those were directly targeted to the health systems and the health and social care organizations. The overall national climate change adaptation plan for Finland for other sectors was published first time in 2014, but then last year, 2024, an update was done, and this is this government report on Finland's national climate change adaptation plan until 2030. And in this plan, for the first time now, then health issues were also included. So our Ministry of Social and Health Affairs was involved in planning this adaptation plan, and heat problems were included as one target of the national adaptation plan. But then having the adaptation plans is not enough, but we need to have implementation, and we can go to the next slide. So how we have tried to start implementing these adaptation plans. I had some examples here where THL has been involved. So we have had an externally funded project where the emissions of health and social care sector were estimated for Finland. And this was 6.5% of the Finland's total emissions. So the health and social sector is actually quite big emitter in Finland, and I think this is equivalent to many other countries in Europe. Then in another project, we have gathered the strategies and implementation plans from the wellbeing service counties who are responsible for the health and social care services in Finland. And we were looking how climate change has been included in these strategies. Unfortunately, there were some strategies not mentioning climate change at all, but then also on the positive side, some already included climate change in their strategies. But we need to make this more common. We have then also in the same project gathered good practices related to climate change adaptation and mitigation in the health and social sector. And we want to disseminate these good practices to several of the areas. And we also did some very practical measurements of the indoor temperatures last summer when we happened to had a very long 3-week heat wave in Finland, and we are now waiting for the measurement results to see how much the indoor environments actually heated up, because we are not really adapted to these heat waves yet. We don't have the cooling systems. But this was also one of the targets in the national adaptation plan, to see what will be the thresholds for the safe indoor temperatures. So we are aiming to give measurement data for this target. We are also developing monitoring tools and follow-up indicators, how to follow how these adaptation plans are actually being implemented. Are things moving forward? And then another target from the national adaptation plan is the preparation of the national action plan to prevent health impacts of heat. And this work is ongoing this year, and this is also being done in cross-sectoral and collaboration, and many organizations are involved in this THL-led work. But most of the work is done with external funding, but anyhow, I'm happy to see that some things are moving forward. Thank you.
Thank you very much, Jaana. This was really interesting insights from Finland and how we are actually it's impressive to see also how early you were able to talk about climate change and also preparing your health systems for the impact of climate change. We know that climate change is the greatest challenge for our healthcare systems in the 21st century. And so it was really early from your part. And we will have time in the roundtable and in the Q&A session to discuss what could be also potential challenges of bringing actually governments on board, but also talking about these topics when we want to increase preparedness in our health systems. So thank you very much. We are now moving on to the second case study, which is from Portugal. And I'm very happy and honored to have to introduce our next speaker, João Vasco Santos, who is a public health medical doctor and professor in health economics and policy. And he's also the president of the European Public Health Association section on public health economics and a researcher at the University of Porto, particularly focused on the wider societal and economic impact of health, including bridging environmental and health economics. And if you remember the very first presentation, the keynote by Julia Zimmermann, she gave us she mentioned the 3 cycles of resilience. So we heard about preparedness in Finland, and now we're going to hear about how to deal and respond to actual shocks. Before then, we move on to the recovery phase in the Austrian case study. So I'm very honored to have you here, João, and the floor is yours, please.
Yeah, my pleasure, Andrea, and it's my honor to be here. And hey, everyone. So indeed, as Andrea was saying, so I will briefly share the Portuguese experience from 2 very different times. So the Eurozone financial crisis and the COVID-19 pandemic, and moving to the Eurozone crisis. And super related to what Julia was saying in terms of preparedness. So basically, before the Eurozone crisis, Portugal introduced several reforms that actually strengthen resilience. So, for instance, we have some examples here, like a broad network of primary care services, the integration of hospitals into the state business sector with much more autonomy for hospitals and debt control, the expansion of generic medicines, which save over 1 billion euros between 2011 and 2014 later on. And the NHS contact center, Linha de Saúde 24, which is basically now the first contact point of triage for the NHS. Then, of course, came the Eurozone crisis between 2010 and 2014. And while there was a clear political intention of keeping the universal coverage, and there was indeed a compromise between the 2 major parties trying to avoid blame between the parties, there was still the problem, particularly in terms of the increase really high user charges, in our case up to 20 euros per visit in the NHS, with staff reduction and a substantial rise in out-of-pocket spending, which reached around 27% of total health expenditure. So, which was really difficult to balance in terms of wanting a political universal health coverage, but at the same time increasing out-of-pocket payments. But even more importantly, I would say that unemployment peaked at between around 20 to 25%, with really limited unemployment support. So while universal coverage was at least intentionally protected, the downside was that equity really suffered. Vulnerable groups bore the brunt of the austerity. Moving on to COVID-19 pandemic, and the next slide, it was a completely different response. So basically, we had co-payments suspended, COVID care was fully free for all. Migrants were temporarily regularized in order to give access to more than 100,000 people to the NHS. And there was a clear investment on unemployment protection, much stronger than during the financial crisis. So, for instance, layoff schemes covered 2/3 of wages, and emergency transfers represented about 2% of the GDP. At the same time, we had digitalization and telemedicine scaling rapidly, maintaining basically the continuity of care. And despite years of underfunding, the public trust on the NHS actually rose in those years, showing kind of equity-oriented measures that indeed supported these trusts in the NHS. But keeping in mind the Julia reasoning in terms of the steps for resilience testing, we really need to look for the lessons learned from Portugal and what I think that we can learn from these two crises. So first, I think that continuity matters. So reforms and preparedness made before 2010 give Portugal really a resilience foundation. Second, financial protection is crucial, like always coverage, I would say. Third, equity really must be in the center. Of course, that the elderly, migrants, and low-income groups always are the most armed in austerity times, but was clearly protected during COVID. And finally, resilience is not only about health systems, as we can see, it's really something in health for all policies and really connecting health with social protection policy. So, for instance, as you can see in this figure, basically, both the Eurozone crisis and the COVID-19 pandemic created similar patterns of vulnerability, but when you can have structural inequities that can amplify risks and reduce access, you can also have strategies such as equity-oriented policies and social protection that not only protect the most disadvantaged, but actually strengthen all the resilience of the system. And that's, I think, in our case, and I think that's also applicable for all the countries, basically the essence of a well-being economy.
João, very, thank you so much for your really comprehensive insights into the two crises that you mentioned, the financial crisis and the COVID-19 pandemic that hit Portugal, and what were your learnings from it in terms of strengthening resilience. For me, what was particularly interesting was also that you mentioned the reforms that were implemented before and that actually created the basis also for the system. And then, of course, what you said about equity and how important it is really to think about financial protection of vulnerable groups, but also the well-being aspects of this. And I think this leads us already to the recovery. So what do we do after a crisis hits? We've heard now about climate change, we've heard about COVID-19, we've heard about the financial crisis. So thank you so much, João, for this broad overview, and we will get back with some questions for sure in the Q&A sessions and the roundtable. It is now my great pleasure and honor to introduce to you the third keynote speaker. I would like to introduce to you Nadine Zillmann. She is a member of the executive board of the Austrian National Public Health Institute. And since 2025, she leads the work on the Gender Health Promotion, which is a funding program that was established in 2022. We're very happy to have you here and that you're sharing firsthand the experiences from the Austrian policy context at the national level on how can we recover from crisis and what can we actually do to move from crisis to well-being society. Nadine, the floor is yours.
Thank you, Andrea, and good afternoon. Thanks for the warm welcome and the invitation. It's also my pleasure. Now, go back one slide, please. So over the next few minutes, I will share some insights with you on how investing in health promotion can strengthen the resilience and also help societies to transition from, as you said, crisis response to sustainable well-being. So the previous speakers have empathized more on the importance of activities on the health systems, However, as we know, health is largely created in the environments in which we live, learn, work, and connect, and not just hospitals and primary care settings. So that's why, alongside with strengthening our health system here in Austria, we are investing more in health promotion to create these environments where people and communities can truly thrive. So similar as we have seen in the video at the start of the webinar and also in the last presentation. So to start off, how can health promotion in general foster resilience? Next slide, please. Earlier, Nina introduced strategies to boost resilience, and here are just a few examples that illustrate how the potential benefits of health promotion measures could apply, like the implementation of heat health action plans or public awareness campaigns that assist communities in preparing for climate-related risks, for instance, through health literacy, or public participation, very, very important factor. So such as co-developing local health strategies with leaders that foster trust or enhance governance. Next slide, please. The pandemic was truly a wake-up call in Austria, and it highlighted the vital importance of public health and the exposed systemic vulnerabilities. So at the same time, it created a window of opportunity for action. And in response, as Andrea was already saying, Austria launched the Agenda for Health Promotion in 2022. It was originally planned for 3 years, but it had now been extended already to 2028. As I said before, to tackle the problems like inequality or mental health, we need to make health promotion part of our education system, of the environment, of the economy, social systems, not just health systems. So the Agenda for Health Promotion is one of Austria's go-to plans to deal with the challenges of crises. Our goal is to shift society's focus on well-being, like suggested in the, as you maybe know, Geneva Charter for Well-being of the WHO. So a well-being society is one where policies or communities and systems are designed to put human flourishing or equity and sustainability first, making sure that everyone can live healthy and meaningful lives. So it puts strategies like health in and for all policies into practice. Austria already had a strong health and all policies tradition, going all the way back to the development of the Austrian health targets already in 2011, that involved lots of different stakeholders and citizens. So the Austrian health promotion strategy that was revised in 24 is also all about helping everyone in Austria to live longer, healthier, and more independent lives. And it puts into practice coordinated evidence-based measures. It's got 4 priority areas, which are also the main focus areas of the Agenda for Health Promotion, that are psychosocial health, social participation, health literacy, climate, and health. So the Agenda for Health Promotion is, and its framework program from 2024 to 2028 is the government's way of helping to put health promotion strategy into action. So what are the main things that make it a success? Well, it's really important that we go from research to action. And we do that by implementing and using the guiding principles of the public health action cycle. We also look at well-being in a way that consider humans and the planetary health perspective at the same time. And it's also vital to get the public and also other stakeholders involved to make sure that the things are relevant, that they're fair, that they're sustainable. So to illustrate this further, I will conclude by presenting a few beacon projects that you'll see on the next slide. So one of it is social prescribing that connects patients with emotional and social needs with the support services like social work or health promoting activities that improve the health and well-being, but are outside of the doctor's practice. A dedicated social prescribing unit here at the Austrian National Public Health Institute has developed a standardized concept for Austria. Currently, there is an open funding call to invite more primary care practitioners to implement social prescribing, as these are often the first point of contact for our patients. Our aim here is to implement social prescribing in all federal states of Austria by 2028. Planetary health action focuses, beside other things, on reducing CO2 emissions within the healthcare system and preparing for the impact of climate change, such as heat waves. So thanks to the Agenda for Health Promotion funding, about 50% of our hospitals has already received climate-friendly consultations and are on their way to become health-promoting climate-friendly hospitals. Also, all federal states have heat health action plans. And the recently revised Austrian dietary guidelines, for instance, now consider CO2 emissions and land use to encourage sustainable food choices. As I said before, participation is one of the key factors of the agenda, and it has shaped the Austrians' roadmap Future Health Promotion, ensuring that we put in place strategies that reflect the real needs of people. So over 1,000 people across Austria contributed to this process by assemblies, focus groups, citizen councils, and online formats. And as a result, we have a bundle of 10 measures that outlined to support well-being societies. And at last, the last example is another example is our Beteiligen-Gesundheit.at platform that enables our public to participate actively in shaping our health promotion activities. So citizens and experts alike can share their ideas via surveys or forums or events such as like a youth dialogue workshops on mental health or a current survey on how to improve our electronic health record system, ELGA. So next slide, please. So I believe now is the time to act, and global challenges like COVID-19, climate change, social inequality highlight the urgency of investing more in sustainable health promotion. So investing in our health and health promotion is investing in our future. Thank you.
Thank you so much, Nadine. This was a very good run through of different initiatives that have been launched in the Austrian context, and also a real important call to the question that Julia posed at the beginning. Where does the health system start? And the health system, in fact, starts with and ends with health promotion, maybe. So it's really important that we keep in mind that our the places where we live and the worlds in which we live are actually have a lot of determining factors. I would now like to ask, so thank you very much, Nadine, for this, and I think we can stop sharing the slides. And I would kindly ask the speakers to turn on their camera, because we're now moving to the round table discussion. And I have a lot of questions actually that arose from the presentations, but I would like to start with one that has been striking me quite a lot, because many of the examples that were presented in the case studies, they seem quite easy. But as public health researchers, as practitioners, and maybe also policymakers, we know that it's not easy. So I would like to hear a little bit more also about the challenges that may happen in implementing these case studies that have been presented. I would like to start with João and would like to ask, because we know that the financial crisis and also the COVID-19 crisis had a big impact in Portugal, and you presented excellent strategies on how to increase the resilience of health systems. Now, my question is, what do you think was the biggest challenge in implementing these measures in the Portuguese context?
So we have this the case that I presented was basically two examples, and when I think about the financial crisis, I think clearly the biggest challenge was the external conditionality. So Troika really pushed for fiscal consolidation and really pushed for specific policies that indeed impact a lot the health system and indeed well-being overall. But I think that this links to an important topic, which is the importance of actually doing research and good research on crisis, on resilience preparedness, on actually well-being economy and well-being policies. I think that's really highlighted, because clearly I think the biggest challenge was external conditionality there. While when you think about COVID-19, and I think that most of us probably were in touch in any moment to this perspective of COVID-19, was basically about speed and capacity. So basically policies like wage subsidies, migrant regularization, and so on, needed to be implemented in weeks, not years, as often is done, but rather in weeks. So basically, that's I think these are the two most important challenges that we will face. And as I think as Julia highlighted in her keynote, I think that resilience is about anticipating, absorbing, and adapting. And so clearly we absorb these shocks, but it's not only about absorbing, indeed, it's about anticipating and later on adapting. So I think these are the next steps, and thanks.
Thank you, João, and also thank you for highlighting again also the importance of evidence speaking to policymakers, especially when a crisis hits, because then often we will not have time anymore to do extensive research. So it's good to have sound evidence and do evaluations already before and on a regular basis. Now, I would like to move to Nadine, because you presented also a lot of really innovative measures and it sounded quite easy. But my question is, can you relate to any of these challenges that João presented also in the Austrian context, or do you have any suggestions on what to do about them?
We certainly did face challenges as well. And the external factors that João was mentioning, I guess, are factors that affect us as well. One thing I want to mention, though, beforehand was I thought it was really interesting to see in the Portuguese example that the trust in the system actually increased during the crisis. And my impression is that the trust in the system, in the health system, and in research, and in the evidence in Austria, I mean, I don't have the numbers, but I don't think it increased. Andrea, help me here. Maybe you have numbers, but I had the total opposite impression in Austria. So that's why, yeah, we try within the Agenda for Health Promotion, we really try to implement, like as I said, the public health action cycle to make sure we have, as you said, the right measures in hand when it comes to it again. For the next crisis that might be around the corner, we don't know. I guess the main challenges for us are right now austerity, like financial issues. Like as you probably know, Austria is in a phase of austerity measures due to not meeting the goals of the European Union. We are feeling it already in the system. We are feeling it at the Austrian National Public Health Institute, that the money that I said was allocated for the Agenda for Health Promotion until 28. I guess I hope it's safe. However, you know, in times of austerity, funds get relocated into other areas. Quite often health promotion then needs to step back in terms of we need to support care, we need to care for the people. So health promotion is maybe not viewed as that important. I don't know. Yeah, so that's one thing. And the other thing that was a challenge or is a challenge is that we just recently had a new government. And when the Agenda for Health Promotion was implemented, we had a Green Party in charge of the Ministry of Health. So it was relatively easy, I say, to put in like all the climate friendly measures, to put a focus on climate and health. And we are not sure yet how with the current government this will continue. So I hope, but I get the signs I'm getting and I'm seeing are that we will be able to continue our efforts on the climate and health area and sector, but it could be a potential challenge for the Agenda for Health Promotion.
Mm-hmm. Thank you so much for these insights, and maybe even there sound and robust evidence about the benefits of health promotion, but also about taking a planetary health approach could be useful approach. And I also hear what you said about trust and the importance of trust building in crisis times, not only in then also conveying the messages that arise from research and from evidence, because if we have all the evidence but no one is listening to it, then we also cannot really use it.
No one is listening, sorry to interrupt, no one is listening or no one understands, which is why one of the key areas in the Agenda for Health Promotion is health literacy, to help the people to understand what's important and be prepared and understand their own health and well-being. So yeah, that's get people and politicians to listen. Exactly.
Thank you so much for this additional comment. And and we've heard now already about climate change and the importance of or maybe also the challenges that may arise in conveying the importance of tackling climate change in changing political times. So Jaana, you introduced a really impressive list of steps that have been taken in Finland to prepare for climate change. And I would like to know, also hearing when you heard also about the other case studies, and were there any things that resonated with you? And most importantly, can you share your secret with us? What were your most important success factors?
Thank you. Well, I definitely support the health promotion part, because if we have healthy population, then the whole health system will be more resilient. There will be less pressure on the healthcare systems and social care systems. So I think that is really the starting point. And of course, the financial issues are quite similar throughout the Europe, I think, at the moment. And also the political environment, how to talk, for example, about the climate change has changed. We were lucky to be early in 2020 when we started to work on the first adaptation plan for the social and healthcare sector. The political environment was more positive towards these issues, and that's how we got started. And we have studied these health impacts of climate change already for a long time. So we had the evidence about the health risks, and then we had active collaboration with the ministry, who is our guiding ministry, our institute's guiding ministry, and this good collaboration with them was then helping with going forward with these adaptation plans. So I think good research base that you can actually indicate that there are these risks and how they are going to change with the aging societies, and then good collaboration with the ministry, finding the right persons there. Possibly not everyone are so interested in climate change issues, but there might be some active persons then who can collaborate and help you forward. And then with the implementation, we have applied for external funding, and for example, these European Union regional development funds, we have received funding from there, and we need to be very active in seeking these kind of funding opportunities to make these things happen. But I think these are some insights from our side.
Thank you so much, and it's also it resonates also a lot with what others have said. So you mentioned a good research base, you mentioned trust between researchers and policymakers, but also then the actual support that you're getting. So I think I'm hearing already a couple of things that resonate with many of the other speakers as well.
If I can just add one more thing. If we can put euros to the health risk, or the saved euros from the health promotion and prevention, then that might actually talk for the decision makers, if we can really monetize these things as well.
Yeah, so to calculate the benefits, the economic benefits. Yeah, okay. So we're very happy to give a task already to João for his group at the UFA section. So I hope that next year then we can do a webinar on this. And I would like now to hear also from our keynote speaker, from Julia, because you had mentioned also that when you do the resilience testing, there are often two things that may that arise. So one thing that we can see is often structural challenges and gaps, and on the other hand, also the opportunities. So I would be interested to hear more about that, but also maybe because sometimes a handbook can seem quite theoretical, and people that are attending and listening right now, they might be asking themselves, from a policy perspective, and we've heard this also in the case studies, it's not always easy to start. So I would like to know what could be a possible first step to improve resilience, in your opinion.
So thank you for this excellent question, Andrea. Indeed, the concept of resilience can be quite daunting if you first start thinking about it. But I think a good entry point would be to start using a case study. So to start thinking about one shock, and that can be either something that has happened in the past or something that is hypothetical, that is potentially a threat that might happen, and from there to extrapolate. And I've already done enough advertisement about the handbook for resilience testing, but allow me to plug it once again. If you follow the step-by-step process, this is a really tangible and a really practicable way to think through it. And by using one shock as an anchor, you can start thinking through the health system systematically. And what we found, as I said earlier, is that not only can you understand some of your strengths and weaknesses specific to that shock, but some of those insights also are valid across a variety of different shocks. And that's your starting point. That's where you go from, by identifying those overarching opportunities to strengthen resilience, and then by broadening your resilience thinking from one shock to different shocks and more shocks.
Thank you, Julia. And I mean, this all sounds great, but I'm still asking myself, who should be the stakeholders that we should really have at the table? Because, for example, one person posted in the chat, what could be the role of civil society in strengthening resilience? And I will give that question also to the other speakers afterwards. But maybe to start with you, and maybe also to share a little bit more, how can we do this actual resilience testing? Who should be the people we should really get on board? What is your opinion?
So another excellent question, and I've already alluded to one of the challenges with resilience testing, and one of the things that you really need to get right is finding and bringing together the right people to have these discussions. So the first thing to say is we're looking for technical discussions here. We're looking for people who have a broad overview of the system and technical expertise in their area. And the second thing to say is that this technical expertise can come from throughout the system. So we're looking for representatives, often from the public sector, sometimes the private sector, and of course also civil society. And we found that in a resilience testing exercise, which we did with IOM and which we're actually presenting in our workshop at the conference, that it was often civil society that was the first to respond to the influx of migrants from Ukraine in all the countries where we conducted resilience testing. So they have an important voice and important insights to share to help strengthen resilience too. And the second thing to say about choosing the right people in the room is that you really need to think about the shock that you're testing and to tailor the people in the room to that perspective, because as you say, resilience can be overwhelming and you can't do everything at once. So extrapolating from the shock scenario that you're thinking about, who are the right people with the right expertise, and bringing those together.
Okay, so thank you so much. Yeah, I am hearing that it's, on the one hand, it's about kind of separating different crises and looking at them in depth. At the same time, as we've seen today, also there are a couple of key issues and key foundations that we maybe can apply to different crises. And it might be also, if we talk about financial austerity, that actually we don't have the resources always to think about different crises at different places. So I'm wondering, are there also some unifying things that we need to think about when we talk about tackling crisis. What is your opinion, Julia? Do you understand my question? So on the one hand, tackle the crisis separately, and on the other hand, are there some lessons learned for all crises also in your opinion?
Yes, absolutely. And I'll refer you back to my second slide where we collected the overarching strategies for improving resilience from our 2020 policy brief for that. And I think it is always context dependent on the system itself and on where exactly the nooks and crannies are that might be amenable to improving resilience. But it's also important to bear in mind some overarching principles, such as what was set out by that policy brief. So you're quite right that there are some overarching principles that can be followed, but really it needs to be applied and made applicable to the context of your system. And here, listening to your stakeholders is really important so that you can translate those overarching concepts into what will actually work within your system.
Okay, thank you so much. Now, we are already moving to the final round, and I would like to pose also the question that I posed to Julia on the civil society's role. And Nadine, actually, you had mentioned participation as an important element. So maybe you can also elaborate and then also give your concluding statement, please.
Well, I cannot stress enough how important it is to involve people in the civil society into what we do, because quite often I feel like we have the tendency to just draw out strategies and things on our desks, or in the best of cases, talking to politicians. But quite often we leave the people out that we actually do make this for. This is our job. Our job is to work for the people out there. And we've made such good experiences with participation. And also, I do know it is a lengthy process, and quite often people, that's the reason why people decide maybe not to include them, or I don't know, just ask them how was the seminar, and they say, yeah, it was good or bad, and that was participation. No, it's not participation. Participation is really to ask them what they need, what they want, go into discussions with them. And with the future health promotion roadmap that we developed, I think, as I said, like 1,000 people were involved. And one thing that actually was really important also to the people that we worked with is that the then Minister of Health, he was part of the program, and he was part of it, and he met with the people, and they presented their suggestions to him, and he listened to them, and then he invited them again 1 year later into meeting with him, into a dialogue, to hear what has happened. Has something happened? And if not, it was also their chance to ask him, why did nothing happen? And I think that was just, I don't know, it was a key example of how it should work. And also at the same time, we're trying at the moment to come up with a strategy to involve people more into the health system decision making and into how the health system is shaped and created. And we know it's difficult, and we know it will be difficult discussions, but we think I think it's the crucial factor to involve the people that we are actually doing this for.
Okay.
So yeah, that's my like I can't stress it enough. Like, this is my final conclusion. Like, first invest into health promotion, and secondly involve the people that we are doing this for, because they are the ones that feel it straight away if there is a crisis. Yeah.
Thank you so much. And I would also like to pose this question maybe to João first, and then Jaana, you have the final words of this webinar. So João, please, what are your thoughts on this point?
I think that linking to something that I've already said also, and to other colleagues as well, I think it's first things first. I think it's important to indeed go through this, for instance, in this case, go through a framework, go through for instance, resilience testing, and actually getting conclusions. So basically, like, it's not only again about anticipating and observing, it's really also about adapting afterwards. And then we really need to have ready-to-use policies, like when there is a crisis, we really need to have, again, research, or it doesn't need to be necessarily research, but at least with some degree of research on it, but that give us ready-to-use policies. And we are talking today much about national/international capacities and case studies, but you can actually think about these locally, regionally, and so on. So, for instance, in Portugal, and we could go for another webinar on another case study, we had recently a blackout in the whole country that actually was a really important shock for all the main activities in our society, including health, of course. And having ready to use and preparedness, as Yola was saying, already in board, already in place, actually made a difference. And of course, this preparedness needs to be done with everyone, of course, civil society, of course, the main stakeholders, like everyone, of course, making still research and our institutes efficient, I would say.
Thank you. That was a very good concluding comment also. Thank you. And finally, Jaana, please share also your views with us.
Thank you. I guess I can only agree with what others have said, that having the different stakeholders involved in the planning of different strategies, programs, policies is needed, because when we hear these different stakeholders, the people for whom we are making these actions, will make them also implement these things better if they feel that they have been part of the planning and they are part of the process and they are part of the policy and they have been heard. Of course, we probably can't take everything that they want to say and tell, and we need to still base everything on research. But I think it will then make things move forward so much more smoothly if we have the relevant stakeholders in the processes.
Thank you. Jaana, you pointed also to some of the possible challenges on which we could probably also have another webinar, because of course, as Nadine said, it can be also a lengthy process, but as we've seen from the examples that we've heard, also it's worth it. And I would like to conclude by also referring again back to the chat and the different workshops that have been posted, because as you know, many of these topics that we touched upon will be covered also at the European Public Health Conference in Helsinki itself in about 2 months. And this was the last one of the webinar series ahead of the European Public Health Conference. There's still, I hear, some spots available at the conference, so be quick in registering and not missing out on all of these workshops. And yeah, so with this, I would like to conclude this webinar. Thank you so much to all the speakers for your excellent presentation. Thank you for the participants in joining us and in joining us on the way towards more resilience and well-being in a planetary health era, in our health systems, in our respective countries. Feel free to reach out to the organizers of the conference, but also the individual speakers if you have any further questions. And I hope you still have a very good afternoon. Thank you for joining.